Hello and welcome to my channel. In this lecture we'll be discussing the gluteal region, so let's begin. The muscle grouping of the lower limb goes as follows. We have muscles of the iliac region, like the iliacus and psoas. We have muscles of the femoral region, like the muscles of the thigh, either front, medial, or back. Muscles of the gluteal region, which is the posterolateral surface of the hip bone, what lies on it. This is the gluteal region. Muscles of the leg and muscles of the foot. This is the plan we're going by. Today is the gluteal region, this region. It's posterolateral to the bony pelvis and proximal end of the femur, and they divided the muscles into superficial and deep groups. Superficial group of muscles are large muscles like the gluteus maximus, medius, and minimus, and the tensor fasciolata muscle. These are considered the superficial group, and they are big muscles. The deep group, as you can see here, smaller muscles like are the ones posterior to the hip joint. They are mainly lateral rotators of the femur at the hip joint. It includes piriformis, obturator internus, externus, and externus muscles, gemelli. All the muscles we're going through in details in a while. The gluteus maximus muscle. The gluteus maximus muscle. It arises from, it's a big muscle, multifascicular muscles. Arises from the posterior rough surface, posterior to the posterior gluteal line, arises from the sacrum, from the coccyx, from the sacrotuberous ligament, even reaches to the the fascia of the erector spinae muscle. It descends downwards and lateral. Because it's a thick muscle, it has a superficial insertion. The superficial insertion into the greater trochanter. Posterior rough surface on the back of the greater trochanter. The deep fibers in the gluteal tuberosity between the vastus lateralis and adductor magnus. It also inserts into the tensor, the iliotibial tract. Helps the tensor fasciolata in its action. There is a bursa between the muscle and the greater trochanter. This is a dissection of the gluteus maximus muscle. See the wide origin and the insertion of the muscle. I want to draw your attention to the fact that the inferior border of the gluteus maximus is not the gluteal fold. The gluteal fold, actually this way, it transects the inferior border of the gluteus maximus. See, this is the gluteal fold of skin. It does not correspond to the inferior border of the gluteus maximus. Relations of the gluteus maximus. Superficial, we have, of course, fascia, adipose tissue, and it's enclosed in the fasciolata of the thigh. Deeply, it's related to the muscles and structures exiting the greater sciatic foramen, and muscles attached to the ischial tuberosity. All these muscles you see here. And as I told you before, the inferior border is crossed by the horizontal gluteal fold. It's a site for intramuscular injection, and as you can see here, to avoid all these structures, especially the sciatic nerve, we go in the upper lateral quadrant of the muscle and inject in the upper lateral quadrant. For its attachments, its action is a powerful extensor at the hip joint. And to your surprise, it's relaxed during walking. This is a multiple choice question. It's a powerful extensor. It's not the main extensor. The main extensor are the hamstring muscles, which contract continuously in walking and running, okay? But the gluteus maximus is used, for tough extension, like in climbing and in jumping, climbing the stairs, This is the action of the gluteus maximus. Okay, upper fibers may share in abduction at the hip joint, and its attachment to the iliotibial tract provides, a means by which the muscle fixes the femur on the tibia during extension of the knee by pulling on the iliotibial tract, because the iliotibial tract comes from the iliac crest to a point on the lateral surface of the tibia, not the fibula. Okay, the gluteus medius muscle, deeper, posterior part deeper or covered by the gluteus maximus, takes from the area between the anterior and posterior gluteal lines, descends to the lateral surface of the greater trochanter, and the anterior 2/3 of the muscle has skin and fascia only on it, so it's under the skin, but the posterior third is covered by the gluteus maximus muscle. The gluteus minimus muscle, further deeper to the gluteus medius muscle, and it takes from the area between the anterior and inferior gluteal lines. Remember the gluteal lines we talked about last lecture. Descends to the anteromedial surface of the greater trochanter, and for its position, it's directly above the hip joint, so it sends a slip to the capsule of the hip joint. Okay, and it's only the hip joint and the reflected head of rectus femoris beneath or deep to the gluteus minimus. The deep branches of superior gluteal nerve and vessels between the gluteus medius and minimus. The superior gluteal runs between the medius and minimus muscles. This is the gluteus minimus muscle. See, this is front, this is back, and this is the piriformis muscle. These are the superior gluteal nerve and vessels running between the medius, which is excised here, and the gluteus minimus, which is in anatomical position in this specimen. Nerve supply of the glutei medius and minimus. Nerve supply of the gluteus maximus by the inferior gluteal nerve. Nerve supply of the gluteus medius and minimus is by the superior gluteal nerve. Okay, so there is a difference. The gluteus maximus by inferior gluteal nerve, while the medius and minimus by superior gluteal nerve. The action of these muscles is to abduct at the hip joint, but it's not the typical picture of abduction as you can imagine, like abduction of the lower limb in this direction. No, actually it's used primarily in walking or standing. When you elevate the other leg off the ground, the pelvis will tend to fall to that direction because it's not supported anymore by the leg. So here the gluteus medius and minimus kick in and abduct its hips so as to maintain the level of the pelvis in the horizontal position. So they act by alternating action. When the leg of the other side is lifted off the ground, the muscles of the same side contract and vice versa. That's why when something happens to these muscles, it causes what's so-called the waddling gait, the gait of the duck. I see how the duck, walks. The same thing happens to the pelvis, tends to fall down on either side whenever the leg is taken off the ground. The supportive effect of glutei medius and minimus for the pelvis, depends on the intact nerve supply, the normal components and fulcrum of the hip, and the intact femoral neck with normal angle. All these must, join together to provide stability and support for the pelvis in the horizon. Lost in atrophied or paralyzed muscles like generalized, disease like Duchenne paralysis, These patients have enlargements of the muscles, and especially the cardiac muscle, and they don't live long. And it's an anomaly in the muscles, Duchenne paralysis. Or congenital dislocation, like the one we talked about last time, the superior dislocation that happens. It's the common form of congenital dislocation, or like the coxa vara, or the non-union of the fractured neck of the femur. So anything that affects the femoral neck and the fulcrum of the hip and the nerve supply of the muscles. The quadratus femoris muscle takes from the upper part of the external aspect of ischial tuberosity, goes to the quadrate tubercle, and little below it on the intertrochanteric crest. Remember the intertrochanteric crest we talked about? It has a quadrate tubercle for the insertion of the quadratus femoris, and a little below it. It's between the inferior gemellus and the upper margin of adductor magnus, and between it and adductor magnus are the medial circumflex branches of medial circumflex femoral artery. It's posterior to the hip joint, separated by tendon of obturator externus and the ascending branch of medial circumflex femoral. Action is to lateral rotate at the hip, and the nerve supply is by nerve to quadratus femoris, L5, S1, 2. The obturator externus muscle, like the obturator internus, this one arises from the obturator membrane surrounding bone and goes inferior to the hip joint and then posterior to the hip joint, as you can see here. So it's an inferior relation of the hip joint and posterior relation of the hip joint, because it ascends posteriorly to its insertion in the trochanteric fossa. Remember the trochanteric fossa we talked about on the medial surface of the greater trochanter. The trochanteric fossa. It's not for the obturator internus, it's for obturator externus. The obturator vessels are between the muscle and the obturator membrane. The anterior branch of the obturator nerve above the muscle, and the posterior branch pierces and supplies the muscle. Action is lateral rotation at the hip joint. The superior gluteal artery, it's one of the branches of the internal iliac artery, supplies piriformis surrounding muscles in the pelvis, then passes between the lumbosacral trunk and S1 and exits the pelvis through the greater sciatic foramen above the piriformis, as you can see here. It divides into a superficial branch, that goes superficially to supply the other muscles, especially the gluteus maximus, and the deep branch. The deep branch splits into superior and inferior branches. The superior branch on gluteus minimus to anterior superior iliac spine anastomosis. Posterior branch also on minimus, between it and medius, supplies it and ends in the tensor in the trochanteric anastomosis around the greater trochanter. See the superior and inferior divisions of the deep branch of the superior gluteal artery. The inferior gluteal artery, on the other hand, also a branch of the internal iliac. It's larger of the anterior division terminal branches, actually. Descends anterior to sacral plexus and piriformis, passes between piriformis and coccygeus, exits through the greater sciatic foramen, but below the piriformis, with the sciatic nerve and posterior femoral cutaneous nerves. This is the inferior gluteal artery. In the pelvis supplies the surrounding muscles. Outside the pelvis, it gives a branch to the gluteus maximus to supply. It gives an artery that runs on the sciatic nerve. It's called the artery of the sciatic nerve, to supply the sciatic nerve, and anastomotic branch to the cruciate or cruciform anastomosis level with the lesser trochanter of the femur. These are the main branches of the inferior gluteal artery. The superior gluteal nerve Also exit pelvis through the greater sciatic foramen, but above the piriformis. And it divides into superior and inferior branches. Superior and inferior branches between the gluteus medius and minimus, and ends in the tensor fasciae lata, supplying all the muscles, gluteus medius and minimus, and tensor fasciae lata muscle. This is the superior gluteal nerve. The inferior gluteal nerve, on the other hand, below the piriformis, and supplies, as you can see here, the gluteus maximus muscle. Supplies the gluteus maximus muscle. Okay? These are the superior and inferior gluteal nerves. Now the last thing to talk about are the dermatomes. The dermatome means a strip of skin supplied by a cutaneous nerve, and we need to know the origin of that cutaneous nerve in order that when we test a dermatome, we can detect any lesion in the spinal cord itself. If the dermatome is lost, means the something wrong between the dermatome and the spinal cord segment that gave rise to this dermatome. So on the gluteal region, I want you to know the fact that the iliohypogastric and sometimes the subcostal may reach the upper lateral compartments of the gluteal region. Okay, this is a multiple choice question. It may supply the iliohypogastric and the subcostal. Also, all the rest are from dorsal nerves and lumbar nerves, but from branches from S1 to S3, coming from these circles, coming from the branch from the posterior femoral cutaneous nerve, which is not from the dorsal rami, but from the sacral, but from a plexus. The lymphatics of the lower limb, all the lower limb is drained to the lateral group of the, not actually, they are, the superficial inguinal lymph nodes are T-shaped with a horizontal limb and a vertical limb. The vertical limb for the lower limb. The lateral limb of the T is for the gluteal region and the lower abdomen, as well as the medial limb of the T is for the pubic region and the lower abdominal wall. So the gluteal region drains into the lateral group of the superficial inguinal lymph nodes. This concludes the talk about the gluteal region. I hope you got the maximum benefit from this lecture, and thank you very much for watching.